Welcome and good morning. I'm Keith Reynolds, host of Morning Coffee. Today we're going to do a little bit of a special show today. The rest of the show will follow after this. But you know what? I have been affected by pain management in my life, or pain. I have a very close person to me that always has been suffering from pain. And some of the things that you go through, I don't think people are really aware of. I brought some experts on to talk about pain, talk about treatment. Today I have Dr. Akole and Dr. Abbasi. So, doctors, welcome to the show.
Thank you.
They are from Advanced Pain Management and Acupuncture.
Correct.
Well, let's get them to get to know you. I'll go with you, Doc, first. How did you get into medicine?
Yeah, actually, it started when I was 9. My mom had breast cancer at the time. We're talking about 1970, and she had a lot of pain. At the time, just 70, the pain was not a factor. It's mainly the treatment of cancer, even so it was not that advanced. And since then, God bless her soul, I always thinking about that because I hated to see her on pain. So my focus is to help people to treat pain and help them with their situation. And the secondary, my dad was interested for me to go to medical school, and I found going to medical school and going to do pain management fellowship was the way that I will love, and I hope that is the way my mom was looking for me to be. And that's why I did internal medicine, then I did anesthesia fellowship at Einstein University Hospital, and then I did pain management fellowship at Einstein University Hospital, and then I was teaching at Yale University School of Medicine for a few years. I was assistant professor over there, and really it did help me a lot. I think it was a way for me to teach and help pain management. And then after this, I went to private practice since then. I've been doing this for almost 20 years now.
I was going to say, Doc, whoa.
I can tell you my age. I'm 53 young.
Really?
Yes.
Okay. All right.
I still love it. And I think I always look to each and every patient as one of my family, and it makes a big difference, really. And I'm really having fun. I'm really happy.
You know what, Doc? I'm glad you said that, because honestly, like I had a family doctor forever, and he retired. And you know what? I just couldn't get past the people that were running the office, the doctors in there. That personal touch. You got to. I mean, if you're going to take them under your wing and say, I'm going to take care of you, they're going to, they need to believe in you and everything. So that's important.
Right.
Okay.
Yes, no doubt about it. No doubt about it.
So, Doc, how did you get into medicine?
Yeah, actually, I was inspired by my uncle, who was a doctor. So I saw his dedication to the work and his care, how he cared his patients. So impressed by that, and my father actually always wanted me to be a doctor. So those factors, played a big role in getting me into this occupation.
Now, what do you think? Like, and I don't know, either one of you can answer this, but I mean, how do you think from when you guys started being, or learning to be doctors versus now? I mean, what's the big thing out there? What's the difference? If someone was going to say, I want to be a doctor, what would you tell them?
I think it is beautiful and great thing. I have 5 kids. My older 2 in the college. I try to push them to medical school.
Yeah, they don't listen to us.
They usually, he doesn't know anything. You just forget about him. It's like an hanger. But I mean, I'm hoping I can convince them to go to medical school. Even so, it is a little bit hard working in the beginning, but I think it is very, very rewarding. Rewarding psychologically, rewarding financially. There is no doubt about it. And I think it is you can every day there is something new.
Yeah.
It's not boring at all. It's hardworking, no doubt. When you get a little bit older, you slow down a little bit. But I think when you slow down, you compensate with your experience. I think when I start medical school, when I start as a physician, I did not have the experience which comes with it. Now, after 20 years, I'm looking back. There is no doubt about it. I learn a lot, and I do things a little bit differently for the better outcome.
Okay.
It's in medicine. I always say medicine. It's in a gray zone. It's not white. It's not black.
Right.
It's in the middle. So it takes some time to balance that, the advantage and disadvantage. Everything has some disadvantage and everything has advantage, but you have to balance both of them to reach that better result and the better outcome.
Okay. Yeah, I agree. Definitely. Now, for schooling, I mean, it still takes 8-10 years for school.
No, actually, a little bit more. I finished medical school in 1986, and then after that, I did internal medicine. That's another 3 years. Then I did anesthesia, another 3 years. I did pain management fellowship, another year, and then after that, you practice. And I think teaching in one of the Ivy League university, I think it did help me a lot. It did give me insight, and I did see a lot of patients which everybody gave up on them. And I think I learned a lot. I learned from them. I learned from my resident. I learned from my fellows. So now I have, I think, some knowledge and to make me understand better different patient and to approach patient differently according to their complaint, according to their background, according to the requirement and needs.
Okay.
Makes a big difference.
Yeah, it definitely does. You know, I got to ask this because every time I have professionals on, I ask this question. Do you guys watch doctor shows?
Not frequently.
No. We're going to take a quick commercial break, and we're going to come back, and I want to get into your practice.
Okay.
Find out what you guys do. I've read up on you guys. You do some phenomenal work, and we really want to talk about that. So we'll be right back after this commercial break.
Simply Gents, located in Marlton, New Jersey, takes care of all your grooming needs, including haircuts, straight razor shaves, massages, facial, manicures, pedicures, and waxing. To find more information or book an appointment, visit us online at www.simplygents.com. The secret weapon of a well-groomed man, Simply Gents.
When it's time for Jersey Mike's to make a really great sub, this is what we do. It's what we've been doing. It's what we've always done. It's what we'll always do. So what are you doing? Jersey Mike's. Be a sub above.
Today's show has been sponsored by More Than Gifts. Come see our new location in Marlton, New Jersey. Not just gifts, but more.
Today's show was brought to you by Alicia Kelly of White Horse RV Center in Williamstown, New Jersey. Alicia is your RV expert. Contact Alicia at alicia@whitehorserv.com or give her a call at 856-262-1717, extension 203. When you think of RV, think Alicia Kelly.
Extra Innings is the nation's premier indoor baseball and softball training center, featuring indoor batting cages, 7 multi-use tunnels, and training rooms. Extra Innings can provide professional instruction, private and group lessons, and the best year-round clinics. Along with a nationally recognized pro shop that features the latest and widest selection of equipment and apparel, our experienced staff can provide you with the right instruction and help you find the best equipment for your ability and budget. Extra innings, where the game never ends.
When it's time for Jersey Mike's to give a sub some sizzle, this is the way. The way it's always been. The way it always should be. The way it always will be. Because that's just the way it's supposed to be. Jersey Mike's. Be a sub above.
Today's show has been sponsored by More Than Gifts. Come see our new location in Marlton, New Jersey. Not just gifts, but more. Today's show has been sponsored by Farmers Insurance in Voorhees, New Jersey. To protect your assets and the people you love, call Mike Skoranek, your local Farmers Insurance agent, at 856-336-2553.
We are farmers. Bum, ba-dum, bum, 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 bum.
Well, welcome back. I'm Keith Reynolds. If you're just tuning in, this is a special edition. As I opened up the show with, I know several people, family members, friends, that go through pain every day. And, I see the outcome is not always the greatest thing. People suffer. They're on medication, addictive medication. So today, this morning coffee, I bought some experts on to talk about people's pain and how to get better, because these guys are doing phenomenal work. It's advanced pain medicine and acupuncture. Okay, welcome, doctors. Why don't you tell the folks, where are the facilities?
We have one in Hamilton, and the second office in Edison, and the third office in Keyport.
Okay.
So it is usually, we did choose this office because I think there is a big need for pain management in this area. And there are three of us, Dr. Abbasi, me, and Dr. Avhad, she's busy today, that's why she was not able to make it, but she is one of our partners.
Okay. Name some of the things that actually people go to you for.
Yeah, actually, mainly we can divide pain management into medical management and interventional pain management.
Okay.
So we work frequently on a spine pain, mainly neck pain, lower back pain, leg pain, knee pain. And in reference to the interventional pain management, which has been very popular in the last few years because it has great advantage to decrease the requirement of medication, especially narcotics. And as you are well aware, the narcotics now is being used very, very frequently, or let me say abused very, very frequently.
Absolutely.
It doesn't mean that we don't prescribe it, but the limitation of using narcotics is going down. That's why interventional pain management play a big role in this. We're talking about epidural injection, transforaminal epidural injection, facet injection, minimally invasive discectomy, which we do frequently, which you will be able to go to work, back to work within 2 to 3 days, spinal cord stimulator, sympathetic block, multiple procedure, which we think that it will help the patient to control the pain, do their daily activity with less pain, enjoy their life, and if they need medication, we can always adjust the medication with this interventional pain management so they don't need a lot of medication, because as you know, when you use medication, there is always side effects, sleepiness, drowsiness, confusion, ensure physical and psychological dependence.
Okay. Now, I think the most popular thing for our listening audience, people talk about herniated disc, and actually on your website, when I was doing my research about you guys, there's a video up there that shows a herniated disc.
When a patient has a herniated disc, so there are different treatment options we do. So patient does not start right away with these intervention and those things. So initially the recommended treatment is you start conservative treatment, which includes some physical therapy. So in our office we have physical therapists working with us. So if a patient is coming to us, low back pain or neck pain for a few weeks or month, 2 months, we start them on physical therapy, give them some anti-inflammatory medication, and see the response of the therapy. Some patients respond very well.
Right.
The pain goes away completely just with therapy exercises. And those patients who do not respond well to these conservative means, like conservative also includes acupuncture. So those patients who do not respond well to conservative treatment, they are gone to interventional treatment. So they get different kind of injections. So we do all kind of injections.
Now, you know, I sit there and
If
say,
it's okay with you, I'll add a couple of points. It's just for the audience to understand. The study shows that 40% of the population, they have herniation. So the patient or the audience needs to understand when you have the MRI and you have herniated disc, don't get anxious, don't get upset. 40% of the United States population, they will have disc bulge or disc herniation. And then you have 10%, the study shows that 10% of the 40% will have some problem.
tell us a little bit, I mean, you know, I said, you know, you said you have a therapy area
The facility.
in the facility. Thanks, Doc. But, you know, do you think that people are not stretching enough, not doing those things and causing the injuries, or do you see a lot of them because of, you know, maybe accidents, stuff like that, slips and falls? You know, what do you see?
Usually, the first part is accident, and we work significantly with patients who had accident, different kind of accident, and there is no doubt it is a big number of them. They will have some problem, including spine, neck pain, lower back pain, joint pain. The second part is the general public, and there is no doubt in the last few years, the way of life that we have, it's mainly sedentary life. How many hours we watch TV?
Right.
We love sitting on the couch watching basketball, enjoying it. On physical activity, the incidence of injury is much, much higher, and that's why one of the main reasons most of the sports, there is a very high incidence of injury in the first months of the season. Like football player,
Yeah.
frequently you're going to have injury during the training camp. Basketball the same. So there is no doubt you need to stretch, and we always tell our patient the first treatment is exercise, exercise, exercise.
Yeah, you know what, and Doc, just to kind of further your point, now they're talking about no one hitting until the actual day of the season. Well, you're going to have so many injuries that it's going to be crazy if you're not doing those things to help. You know,
That's true, especially with football, because I have few patient, professional football player, and really they frequently they will have injury, very rarely, and sometimes significant injury beside the post concussion headache, which hopefully is being dealt with now. So there is no doubt athletes needs to work out. Normal public needs to work out. If you work out, if you exercise regularly, I promise you, I'm not going to see you frequently.
okay. Now, we talked about covered a little bit about, you know, the type of professions you see, you know, age-wise, okay? Are you seeing kids in there? Or, you know, middle-aged people, I'm sure you're seeing, you know, that's when stuff starts to fall apart on you. And then the elderly, you know, are you guys seeing elderly patients?
Yes, we see, kids we don't see, you're right. But we mostly see, you know, people ranging from around 20 years of age up to 60, 70 years of age.
I mean, my story with acupuncture, it was very interesting. I think very interesting story. It started about 20 years ago when I was doing my pain management fellowship, and I did not believe in it. I said, "You put needle? What's going on? Why? It doesn't make any sense." Until during fellowship, I did a rotation with one of my professor, Dr. Lou, and I see his patient. And most of them, they did great. And actually, those are the patient who everybody gave up to them. It's not painful, even so we use multiple needles. Yes, we use different kind, we call it in acupuncture meridian, and meridian, it doesn't follow a certain anatomical way. It has its own structure in the Chinese acupuncture medicine, but the results are great, especially if you choose your patient correctly. And acupuncture with some other modality of treatment, it will help a lot.
You know what I believe in, because I think it's, you know, homeopathic healing, stuff like that. It's making a huge, huge surge into our world because people are tired of the pain meds. People are, you know, obviously they're tired of the pain, but, you know, there's ways to manage the pain.
That's why, I mean, when I started doing it in the late 90s, no insurance was covering acupuncture. Now most of the major medical insurance cover acupuncture, Horizon, Aetna, Cigna, all these insurance, even Medicare, they are thinking to approve it. As you know, it takes a little bit longer to approve, but there is no doubt it has some role.
So, and some of the other stuff, Doc, that you guys cover besides acupuncture?
We do injection treatment, like we do spine injections, which includes epidural injections, facet joint injections, radio frequency ablation of the spine and
Now,
some joints.
Radio frequency, I know someone that's getting ready to go through that. What is that exactly?
Radio frequency means, you know, we burn, actually heat up the nerve which supplies the facet joint.
Okay.
Burning that nerve is called radio frequency ablation of that nerve.
But you do have to be careful because I'm assuming some things you can't do that to, that procedures to?
Well, that is, I understand where I understand that when you remove the pain or part of the pain, now the patient is not feeling it. Maybe they're going to do stuff which they are not supposed to do.
Right, right.
I partially agree with you. And when we do the radio frequency ablation, usually we're not talking about. Usually we have 70–80% pain relief. That's number one. Number two is the joint orientation. It's still there.
Okay.
What we call it by proprioception. That's why in the beginning we don't go directly to burn the nerve. We just inject local anesthetic, which should help for about an hour or two, and we take the response from the patient if they feel comfortable, if it did give them 60–70% pain relief. If they are comfortable and they are doing well, now we go to the second step, which is the radio frequency ablation.
Now, when you burn it, are you burning with like a needle?
Yes, we do everything now under sedation until the patient. I mean, 90% of the procedure we do it in the surgery center. We do it with fluoroscopy, so that's actually it's very important, and we do it under sedation, so the patient doesn't feel, sometimes even doesn't remember the procedure itself.
Really?
Yes, and we do it with a needle, and after that, before even putting the needle in, we inject some local anesthetic, and then in the recovery room, we always advise the recovery room nurse and the patient use some ice to decrease the inflammation which follow the procedure for a day or two. So usually if we were talking 15–20 years ago, we used to do it in the office without any anesthesia, which was really not fun. Let's go this way.
No.
Yeah.
We're going to be right back. We're actually going to do a little bit of demonstrating. No, they're not sticking me with needles, but we have some stuff here, and we have some pictures to follow, and the doctors are going to talk about different procedures right after this message.
Simply Gents, located in Marlton, New Jersey, takes care of all your grooming needs, including haircuts, straight razor shaves, massages, facial, manicures, pedicures, and waxing. To find more information or book an appointment, visit us online at www.simplygents.com. The secret weapon of a well-groomed man, Simply Gents.
When it's time for Jersey Mike's to make a really great sub, this is what we do. It's what we've been doing. It's what we've always done. It's what we'll always do. So what are you doing? Jersey Mike's. Be a sub above.
Today's show has been sponsored by More Than Gifts. Come see our new location in Marlton, New Jersey. Not just gifts, but more.
Today's show was brought to you by Alicia Kelly of White Horse RV Center in Williamstown, New Jersey. Alicia is your RV expert. Contact Alicia at alicia@whitehorserv.com or give her a call at 856-262-1717, extension 203. When you think of RV, think Alicia Kelly.
Extra Innings is the nation's premier indoor baseball and softball training center, featuring indoor batting cages, 7 multi-use tunnels, and training rooms. Extra Innings can provide professional instruction, private and group lessons, and the best year-round clinics. Along with a nationally recognized pro shop that features the latest and widest selection of equipment and apparel, our experienced staff can provide you with the right instruction and help you find the best equipment for your ability and budget. Extra Innings, where the game never ends.
When it's time for Jersey Mike's to give a sub some sizzle, this is the way. The way it's always been. The way it always should be. The way it always will be. Because that's just the way it's supposed to be. Jersey Mike's. Be a sub above.
Today's show has been sponsored by More Than Gifts. Come see our new location in Marlton, New Jersey. Not just gifts, but more. Today's show has been sponsored by Farmers Insurance in Voorhees, New Jersey. To protect your assets and the people you love, call Mike Skoranek, your local Farmers Insurance agent, at 856-336-2553.
We are farmers. Bum ba dum bum 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 bum.
Well, welcome back. I'm Keith Reynolds, host of Morning Coffee. It's been a crazy morning. I don't think I had my coffee today or something. But I want to welcome you viewers that are just tuning in. This has been a great segment, and we're going to wrap it up. But before we get into the wrap up, if you didn't see the beginning of this, go back to On Demand and check it out on demand. It's a great, great show. We're talking about pain management, and we have our experts in, Dr. Ikali and Dr. Abbas, advanced pain management and acupuncture. And doctors, we were just, we've covered a lot this morning. We have to have Chevy come back because I could probably talk for another hour with you guys. It's fascinating stuff that you do. But what I wanted to do is we have some little models here. I'll let Dr. Ikali, did I say that right again?
Yes, that's
Okay.
correct.
Go through this, but here we have a mannequin, or what do you call it?
That's actually, it is the acupuncture meridian.
Meridian, okay.
I gonna talk generally so
Yeah.
nobody will get bored from us. But if you look to all these points in front, on the feet, in the ear, and in the back, all that, we call it meridian. There is multiple meridian in the Chinese acupuncture, and each meridian and each point will treat a specific pathology. There is no doubt about it. It will help a lot with neck pain, lower back pain, joint pain, and as you are well aware, acupuncture has been approved already by FDA for nausea and vomiting with chemotherapy. And there are many studies indicating the benefit and good outcome from acupuncture with some other modality, not only acupuncture. So as you see here, for neck pain or lower back pain, usually we use something called a bladder meridian. It is about maybe a little bit an inch from the midline. We got very tiny needle, and we go along around the area over there. In the ear, there is, as you are well aware, is every part of human body are being represented by in the cerebral cortex in the brain is exactly the same in the acupuncture and in the ear. So each part of your body are being represented in certain part of the ear. That's why I use acupuncture for diet control, for smoking, for cocaine abuse, and multiple other modality. We can use a needle in the ear. And the needle for the ear, is a little bit different than the needle we use for the back. It is a needle which, very tiny needle, it has a seal on it. We keep it in the ear, you go home with it, and then we'll change it every few days.
Cocaine abuse?
Yeah, actually, we did some studies in the 90s about that. Was group treatment, and with acupuncture, it's really the incidence of recovery is faster, and the incidence of reusing is less. Acupuncture, we're talking about how acupuncture works. One of them, it is releasing the endogenous morphine of the body. And the study shows that when you do acupuncture and they do the level of endogenous endorphin and enkephalin, which is much, much stronger than morphine, it will go up. That's why when I do acupuncture in the first 2 sessions, I always explain to my patient that maybe they'll be a little bit sleepy or drowsy in the first couple of sessions, and then after that you get accustomed to it. The second theory, which is the gate theory, it is just a little bit medical term, so it is just merely it closes the door from the pain to go from the arm to the brain, and subsequently helps significantly with the pain.
Right. Wow, that's amazing. Now, even in some of the pictures we have, they have acupuncture in your feet. What would you do?
Acupuncture in the feet, there is different kind of acupuncture in different places. Sometimes we use acupuncture in the feet to treat certain like fasciitis, plantar fasciitis. We use some point in the feet. There is another important point, we call it large intestine 4, which here in the between the first and the second finger, which is very, very important. We use it frequently in different pathology. So sometimes when you go to acupuncturist, they put the needle in certain area which does not have the pain. It doesn't mean that it doesn't work. Right. But according to the Chinese medicine, there is for each pathology, there is certain point you need to use, and you need to put the needle in to become more effective. And there is studies show that if you put the needle anywhere in the body, and you put the needle in the specific area, the resulting of putting the needle in the specific area, which we call as the acupuncture meridian, Chinese meridian, it's much, much more effective.
Yeah, that's interesting because, are you familiar with Reiki? It's what I mean, with the feet, and like it's almost like a massage for the feet, but there's points on the foot, and that's kind of, I guess, similar to what you're talking about. There's points, I've had it done like twice, and like they'll say, you're having problems digesting. You know what I mean? Yeah, I mean it's close, but I don't know how they say it by feet, but I'm assuming that everything is connected.
Correct.
So now there's also another picture that's pretty fascinating. You have the acupuncture is right in the middle of the palm.
Yes, the middle of the palm, usually what we have tendonitis, it helps significantly with inflammation of the tendon of the finger, or if you have your finger is getting locking the finger. Usually it happens a little bit patient older than 45 or younger than 45. Is older than 45-year-old. Usually it helps significantly, and instead of doing injection and instead of medication. So subsequently the side effect is significantly less.
Wow. And then obviously we got the pictures of the back and spinal. That pretty much, that's our operating system.
Correct.
Besides our brain, that's,
correct. Yes.
Okay. Well, doctors, I want to thank you so much for coming on. We definitely have to have you come. I'd love to have you come back, talk a little bit more about some of the procedures and get really in depth about some of the procedures you do. And actually, do you guys ever show those procedures?
Actually, in our webpage, njnopain.com, there is an education section. It can go to our video, and you can see exactly what are we doing. It is, I think, very informative video. But right. On the other hand, if you get anxious from needle, if you get anxious and scared from doing procedure, don't watch it so you don't get fainting attack or anything.
Why don't you tell the listeners and viewers out there where they can find you? Your
The 3 locations for advanced pain management are Hamilton, which is on the Quaker Bridge, Mercerville Road, 1255 White Horse, Mercerville Road in Hamilton. The other location is in Keyport, which is 250 Maple Place in Keyport. And the third location is in Addison,
Okay.
which is on Oak Tree Road.
Which is what?
Oak Tree Road.
Okay, Oak Tree Road. All right, docs, thank you so much for coming on the morning coffee for a special edition. For you listeners out there, stay tuned, don't change the dial. Well, we don't call it a dial in 2016. Don't move off the screen, because we're coming back with more